Hi, my name is Dr. Drugatosh Pandey and I am the head of surgical oncology and Oncology Sciences at Manipal Hospital, Dwarka and Gurugram. Today we will be talking about gallbladder cancer. Now, gallbladder is an organ which is notorious for having stones. But in this part of the country, especially in the northern part of India, the cancer of the gallbladder is also quite common. It is perhaps 20 times more common than in the usual population in the other parts of the country and the world. The reason for this kind of an incidence is really speculative mostly, but we are going to focus our attention on the symptomatology and management of this disease. Unfortunately, the gallbladder cancer and the other diseases of the upper abdomen have quite overlapping symptoms. So often a symptom of gastritis, jaundice, and non-specific pain in the upper part of abdomen can be a symptom of gallstone disease, of acid peptic disease, and also of a gallbladder cancer. An ultrasound of the abdomen may give some indication to whether it is just a stone disease or it is a gallbladder tumor. If there is an eccentric thickening of the gallbladder, if there is a mass in the gallbladder, it indicates more towards a gallbladder cancer. Now, what is the treatment of gallbladder cancer? First, we need to understand the stage of the disease. And the stage of the disease can be understood by doing a contrast enhanced CT scan of the abdomen and chest or a PET scan. After understanding the stage of the disease, if the disease is localized to the gallbladder or if it has involved a little part of the liver, then the first step is a surgical resection of this tumor. In the surgery, it would involve removal of the gallbladder with a part of the liver, that is the gallbladder bed of the liver, along with the resection of the adjacent lymph nodes, which we call as lymph node clearance along the porta hepatis and in the surrounding areas as well. Once this surgery is done, then this whole specimen is sent for histopathology report in the laboratory, and accordingly the patient may or may not require a treatment with chemotherapy or radiotherapy after the surgery. Occasionally, if the adjacent structures are also involved, for example, the bile duct, the small intestine, the large intestine are in close vicinity to the gallbladder tumor and may be involved with the disease. Even in such situations, the disease can be cured surgically by removing these adjacent structures. It can be done quite safely, as we have demonstrated, and sometimes the multi-organ resections may require removal of the gallbladder and liver, which any case of a radical cholecystectomy will require, plus resection of bile duct or resection of some part of an intestine may be also needed. Now, sometimes the gallbladder cancer presents in a locally advanced stage. If a patient of gallbladder cancer has jaundice, generally the stage is more advanced than what we think it will be. In such situations, even if the disease looks like resectable or localized, it is preferable sometimes to start with chemotherapy and then go ahead with surgery. This would give us a good result, a better result than perhaps doing only one part of the treatment, that is surgical treatment or only a chemotherapeutic treatment. A multimodality treatment for such disease has led to a better survival, and the patients can have a good, healthy, full life after the complete treatment of this disease.